Shelley, I've been struggling with many subtypes of OCD since I was 12 or younger. I've been struggling with anorexia since the age of 17 with decades of therapy and hospitalizations. Do you think ERP would be beneficial?
Well, Shelley, let me first express, my sympathy that you've had, quite a long bout, not only with OCD, but also one of the problems that we know, unfortunately, tends to co-occur frequently with OCD, and that's eating disorders. Sounds like anorexia, unfortunately, in your case, Shelley. Um, here's the good news. In response to your question, do you think ERP would be beneficial? I want to give you a categorical yes. I say that because both Jenna and I and our team at NOCD very much put our faith in the science, and the science indicates that head and shoulders above all their alternative therapeutic approaches, exposure and response prevention is the gold standard treatment for OCD. I wish I could sit here and tell every one of you that it's a panacea and that 100% people will derive benefit from it. I can't, but I can tell you that a very significant majority do. And even amongst individuals who don't experience a full and complete recovery when going through a course of ERP, a good number of folks experience, a partial symptom reduction. And what happens is when we get at least part of the way there through a course of therapy, one of the cool things about ERP is, unlike other therapies, it kind of teaches you to be your own therapist. So once you understand that, in a nutshell, what you have to do to overcome this problem is confront feared scenarios while at the same time preventing, your compulsions and typical safety responses. You've become very much your own guide to tackle, what's left of your course of treatment and overcoming OCD. Now, Shelley, you raise an interesting little addition here with anorexia since the age of 17. And what's so interesting, given that how you describe the ordering here, this is typical, Shelley. This is what we see when OCD and eating disorders co-occur. We actually see the OCD more often than not predate the onset of the eating disorder. And what's so interesting about that is we know that there's a tremendous amount of overlap between obsessive compulsive disorder and eating disorders. And as such, there's been a lot of great work in the last 20 years looking at, hey, can we take this treatment, ERP, that has for the better part of a century now shown to be effective for OCD, can we bend it and twist it a little bit and thereby make it applicable to eating disorders? And moral of the story is the answer is yes. If we consider eating disorders to be somewhat of a variant of a larger obsessive compulsive syndrome that might be characterized by obsessions around food and body image and compulsive behaviors that are often aimed at trying to modify weight or shape or minimize the amount of food that one takes in, you can start to see how using an exposure and response prevention treatment approach can be applicable and really help someone that's trying to overcome eating and body image related fears and anxieties at the same time as more traditional obsessive compulsive features. So, Shelley, I know you've been at this for a while. I just want to leave you with some optimism. There's hope, and there are a handful of programs around the country that actually offer specialized treatment where you can dually receive exposure and response prevention for OCD in tandem with the eating disorder concerns.
Mm-hmm. Yeah, and I just want to offer similar kind of validation, and that's this has obviously been going on for a really long time, and the back and forth in my experience clinically, like what I've seen people struggle with who have this kind of overlap is that they can get really frustrated and that they tend to work on the eating disordered, behaviors, but then the OCD riles up, or they work on the OCD and then the eating disordered behavior riles up. And I think that just speaks to the need for us to really work on that overlap, which is a lot of times the perfectionism, the rigidity, the need for everything to be just so, the need for control. And so there's so much overlap when it comes to that needs to be the target in treatment. And I think that's been what's probably been missing for a while. A lot of times with eating disorders, especially with anorexia, there's such an emphasis on weight restoration, which is obviously important. But it's like, okay, well, what? And so especially when there's this overlap of OCD and eating disorders, right? Like, I think it's necessary for us to really target that overlap of the perfectionism and the rigidity and routines, and ERP can definitely help with that. I know where I used to work, we would actually have like a separate fear hierarchy, which would include things like maybe going out in public wearing a shirt that was a little bit triggering to wear, or, you know, short sleeve shirts or capris versus full on jeans or something like that. But then we would also have like a food hierarchy. We would have a legitimate like 5-page food hierarchy that literally listed every food that you could possibly imagine. And just like we would ask a client to say, you know, on a scale of 0 to 10, Shelly, how hard would it be for you to do this? We would ask on a scale of 0 to 10, how hard would it be for you to eat a cup of potatoes? You know, obviously, you know, resisting then exercising, or resisting, you know, then purging, whatever those behaviors would be for you. So I think the overlap is becoming more and more understood and more kind of well known and talked about, which is really good. And I wish you the absolute best of luck. There's so much good help out there for sure. And I don't ever do this. I'm like imposter syndrome, but just because I feel like that validation and that like solidarity could be really helpful. I just did a podcast with someone who reached out to me with this overlap, like the OCD, ED, and that what was most frustrating for her in treatment was like no one treated both. And so the eating disorder professionals didn't really understand the OCD and vice versa. And so they continually went back and forth with each other. She went over amazing advice. Her name is Emily Feldman. She reached out and she says her name in the podcast. She's on Instagram. You can follow her story. But yes, my podcast is called All the Hard Things. Just go and listen to that most recent episode. It's her personal account. And I think that would just give you a lot of solidarity to know that you're not alone. And she has a lot of awesome, awesome advice for that.